Usability is defined in terms of ease of learning to use the system, the effectiveness and the efficiency of the system with regards to satisfaction with the system, the tendency for errors, and finally productivity. That is, how easy is it to accomplish the goals of a task. This chapter focuses on the nurse's role in planning and implementing usability tests that study the effects of computer-based technology on the people who use it. Evaluation of how humans interact with computer systems and how those interactions impact workflow and patient care are essential to delivering quality health care and achieving good outcomes for the patients in our care. A general example of usability testing is the evaluation of using four-way stop signs or traffic lights as the most effective method of traffic control. Usability testing can show that both types of signals are effective, but the four-way stop sign is not as efficient, as satisfying, or as error-free as the use of a traffic light to control the traffic flow through an intersection. The goals of usability testing are to meet the needs of the users, to improve their productivity, and at the same time to safeguard against errors as healthcare is delivered. The method of determining how effective a system is should be a part of the project's design plan. Humans and computers form a complex socio-technical work system. Humans can recognize problems and combine their knowledge and experience creatively to apply them to problem solving. However, they are influenced by their work conditions. While computers can process large amounts of data quickly and error-free and can repeat tasks without fatigue, if the system is not efficient in extracting important information and does not exclude irrelevant data, the system can be frustrating to use. Therefore, usability testing should be part of the project's design plan. Included in the evaluation should be the experience of the user. Because nurses interact with many different and often complex pieces of healthcare technology every day, they have an important role in usability testing. Nurses are involved in evidence-based practice, that is, translating clinical research into practice, and they work in a variety of areas where a particular technology may be used differently. For example, the smart IV pump may need to have different meds and calculations in the ICU, the med-surg, or an outpatient setting. Nurses are very good at figuring out workarounds, that is, ways to do something when the process is not working, and we know that workarounds lead to errors. So nurses are key participants in system design and redesign to address those issues that may lead to errors. There are three dimensions of usability: effectiveness, efficiency, and satisfaction. Effective healthcare information technology helps users to meet their work goals in an acceptable manner by matching the number of functions of the system to the needs of the user, helping the user complete tasks with accuracy. The system must be able to easily recall information for the user, and it leads to quality outcomes. Efficiency measures to assess how easy the system is to learn and use. An efficient system requires little thinking to complete the task. System errors reduce efficiency. Measures include incidence, percentage of time to recover from errors, and the third dimension of usability is satisfaction. User satisfaction is typically obtained through surveys or questionnaires and asks the user to rate the system on the ease of learning and use of the system. Usability testing begins with planning and design of the system. Often a parallel system is designed using the same set of requirements so that users can select between designs. Once the system is designed, experts and users begin testing the system to see where any problems or glitches in the system are so that they can be fixed prior to putting the system to use. The final stage of usability testing comes when training for the new system begins and during the first few months of use, when the users are able to see if any problems with ease of use have been identified.